Hi, my name is Mallory, and I'm going to be your nurse today. I will be assessing your head, eyes, ears, nose, throat, and neck. What do you prefer I call you?
Evan.
Hi, Evan. I'm going to go ahead and get started. What is your height and weight?
6'1" and 177 pounds.
So in most cases, we would go ahead and take your height and weight to calculate your BMI, which is your weight divided by your height squared. And we'd use that to do a chart based on like if you're underweight, overweight, etc.
Okay.
I'm going to go ahead and look at your head. Your head is normal cephalic. It is midline, symmetrical, without lesions. I don't see any edema. Your eyebrows, they are thick, evenly distributed. I don't see any scaling. There's no hair loss. I don't see flaking. And then your eyelids, the color is consistent with your face and you're appropriate for your ethnicity. There's no drooping. I don't see any edema. Your lashes, they are thick, evenly distributed. I don't see any hair loss. The upper lashes grow out and up, and your lower lashes grow out and down. Your conjunctiva is transparent. Your sclera is white. Your irises are blue. They're consistent throughout. Your cornea and lens are free of opacities. I'm going to go ahead and dim the lights and look at your pupil, and I'm going to go ahead and do that right now. Okay. I'm going to start from your shoulder and go across.
Okay.
Perfect, thank you. Your pupils constrict to the light like they normally should. They were appropriate size prior and shrunk when light was added. I'm also going to do an eye test on you. Okay. I'm going to have you point with both eyes. I'm going to have you point where you start and read the numbers from left to right.
Okay. 428-365,
Next.
374-258, 937-828.
Okay, 30 over 20, or 20 over 32.
Yep.
Now I'm going to have you put your hand over your right eye.
Okay.
And go ahead and start from left.
428-365, 374-258, 937-828.
Perfect. Your 20,
Okay.
or 20 over 32, and then other eye.
And then 374-258, 937-828.
And 30 over 32 in that eye. Perfect. I am now going to test for your peripheral vision. I'm going to put my hands behind your head and wiggle my fingers, and just let me know when you can see them.
Yep.
Perfect.
Yep. Yep.
Your peripheral vision is intact. I'm going to also check for the movement within your eyes. So if you can go ahead and follow my finger and keep your head still. Perfect. There's no extraocular movement. There was no stags present. I'm now going to look at your ears. I'm going to move your hair if that's okay. You have been communicating with me throughout this, so your hearing is intact. The color is consistent with your ethnicity and the rest of your body. They're symmetrical and of appropriate size. They are aligned with your eyes. The upper ear is aligned with the outer canvas of the eye. I'm going to go ahead and look inside of your ear.
5 minutes.
Do you have any tenderness inside your ear?
No tenderness.
There's no drainage, no bleeding. It is free of any foreign bodies. Ear canal seems patent. I'm going to go ahead and look at your other ear. Is there any tenderness in this ear?
Nope.
There's no drainage, no bleeding, no lesions in either ear. There's no foreign bodies present. Ear canal appears patent. Perfect. Ears are intact and there's no deformities present. Your ears. I'm going to look at your nose. Your nose is consistent color with the rest of your body and your ethnicity. It's symmetrical. I don't see any deformities, no lesions, no edema present to the nose. I'm going to go ahead and have you tilt your head back. Perfect. I don't see any exudates, no discharge, no foreign bodies are present. The nasal passage also appears to be paid. If you can go ahead and cover one nostril and breathe in. Perfect. And the other. Nasal passages are patent and intact. I'm going to go ahead and look at your mouth. Your lips are pink and consistent with your skin tone. Your lips appear moist. There's no lesions present. I'm going to go ahead and look inside your mouth with my light. If you can go ahead and open your mouth. Perfect. Stick your tongue out and go, ah. Perfect. If you can move your tongue from left to right. Perfect. Tongue up. Perfect. And can you smile for me? Perfect. Thank you. So your upper part was pink. There's no lesions. It was moist. The lower part was pink, moist, also no lesions. Pretty consistent without. The tonsils were present and appropriate for size. They were 2+. Your uvula was midline. It was pink, moist, and there was no lesions present. Without any exudates. Your gingiva or your gums, they were pink, moist, no lesions. Your teeth were white without any misshaping. There was no missing teeth. There was no discolored teeth. The upper part of your tongue was rough. It was pink. It was moist. The bottom part was smooth, pink, moist. There was no odor present. And now I'm going to take a look at your neck and throat. The midline is midline. There's no bulging. There's no lesions. There's no masses, no lumps. The trachea is at the midline. I'm going to assess the lymph nodes. The lymph nodes are where they become inflamed when infection occurs. Usually they are either non-palpatable or they can be small, rubbery, mobile, and non-tender. So I'm going to go ahead, and this is your prefrontal ocular, your post-ocular, your occipital, your tonsillar, your submandibular, your submental, superficial anterior clavicle, your posterior clavicle, deep middle, and your supraclavicle and frontal